602 or visit myhealthcentereddentistry.com.
This is your morning drive. Call 498-7505 or 866-530-0550.
Good morning and welcome back to your morning drive. News Talk 550 KCRS, the voice of West Texas. I'm Chris Moore.
I'm Dale Harris.
In studio this morning, Dr. Richard Bartlett. Good morning.
Good morning, Chris.
I just got to say thank you for coming here. He has been traveling, trying to follow you on Facebook. Your sister's doing such an amazing job of doing the same thing, trying to follow you and keep up with you on Facebook. Y'all have been all over the state and broadcasting all over the United States with spreading the words about budesonide and the antibiotic. Now then, if you would real quick, like we did have a caller call and said, what is the name of the antibiotic that you are using?
So my protocol is the inhaled budesonide with a nebulizer machine and also clarithromycin. Clarithromycin is a generic, inexpensive medicine with food, so it doesn't upset your stomach if you're not allergic. And then for adults, aspirin and zinc. And so that's the recipe for success for thousands of people right now are being treated with this across the country. There are literally hundreds of doctors calling me from across the country who are now employing this protocol and saving lives outpatient before people even get to the hospital to keep them from going to the hospital.
And that is so very important as we're sitting here. And I think what I've seen, and as I watch all the different news places coming out, so many people are not early treating, and then they put them on the ventilator, and that's where the danger is.
That's my message, that early treatment has been the cornerstone of American medicine. We have led the world as far as healthcare goes, with early detection and early treatment being the winning strategy for every disease for decades. Heart disease, stroke, cancer are still the top 3 killers in the United States. COVID is not there. And for every disease, every infectious disease, early treatment is what saves lives and saves heartache and money. And so but this is the only time in American medical history that we have been told to stand down in January as a healthcare system and only go with a plan that's late treatment only. Late treatment only is the message from the World Health Organization that's been repeated. And if you go to a hospital, you might not be sick enough yet. Come back when you're sicker. Late treatment only, which is what ends up with people in the ICU.
Very, very damaged lungs and more.
The cat is out of the bag. There's so much now. There's no way to stop this. Early treatment is what I've been saying from the beginning, and there's a winning. We already have an answer to the problem of COVID. And that's also what I'm saying. And so there 4 million views on YouTube of the video that I did explaining early treatment and a winning strategy of inhaled steroids being a targeted treatment plan. And so COVID is a respiratory inflammatory disease, and budesonide is a respiratory anti-inflammatory solution for it, right to the source, targeting the source of the inflammatory chemicals, the cytokines that are released total body that cause multi-organ failure. But COVID's on its last breath. I'm getting calls from around the world. Literally, America Can We Talk was the interview I did, and so if people go to America Can We Talk and they get on their blog, doctors from the Netherlands, from around the world, are reaching out and downloading that PDF of my 14-page white paper, which will be there's the American Journal of Disaster Medicine is looking at publishing it. How I'd say COVID has been a disaster on so many levels.
Oh my goodness!
How
yes,
appropriate
it has.
is that journal that it's going to be in, could be in. And so we have something that's cheap. When I came across this strategy and started using it, I had patients that said, I can't breathe. And this is a treatment strategy that people say with their first treatment. They say, many tell me, I can breathe. My shortness of breath is gone. My chest pain is going away with the first treatment. It's like the consciousness of all humanity around the world literally is coming to the reality that for $3 at home on my couch, I can get relief while I'm watching Netflix for $3, which is the price of a cup of coffee at Starbucks. You mean and here's what people are realizing. We already have an answer. And so you mean that I can make it through this pandemic without a vaccine? You mean that I can survive COVID without a ventilator? You mean I don't have to suffer for 3 weeks and miss work for 3 weeks? I can get treated earlier and get back to work earlier with an effective treatment strategy? You know, with COVID, people have a long list of symptoms. There's respiratory symptoms of shortness of breath, chest pain. They get hypoxic, their lips turn purple. They're anxious because they're low on oxygen. And that causes a fight or flight reaction.
I can't even imagine.
They have trouble thinking clearly. They have diarrhea. It causes GI symptoms. Some people get dehydrated. There is no FDA-approved treatment. But here's the thing. We treat people. Do the right thing and treat people. And so if they're dehydrated, it's not FDA-approved treatment for COVID, but we treat the symptom of dehydration. We support them. We give supportive care. And if someone's having trouble breathing and they can get an inhaled budesonide treatment with a nebulizer and it helps them breathe, that's a good idea. Breathing's really important.
I've noticed that.
Working in the ER, I have found airway, breathing, circulation really are important. And ABCs of medicine. And we talk about that with advanced trauma life support, which I'm an instructor. Not a lot of doctors are instructors. Every doctor that wants to work in the ER, whether they're a trauma surgeon or an ER doctor, has to be certified in advanced trauma life support. So many are certified, not everybody, but I'm actually an instructor. I am finding that I'm getting calls from Colombia, from El Salvador, from Australia yesterday, the UK, France. Doctors around the world are employing this winning strategy and saving their patients. But you know, when you go to when you look at Taiwan, 7 people have died during this whole 7-month pandemic. 24 million people on an island a third the size of New York State, and 24 million versus 9 million in New York. And for some reason, they already have the answer. And it's, you know what? They're doing they're doing studies right now with inhaled steroids, but they're not depriving their patients of care. They're treating their patients right now while they're doing the studies in the meantime. And they've stumbled upon the same winning strategy of early treatment is critical, and an inhaled steroid is a powerful tool in the fight against COVID, and they're not depriving their patients of it. But here in the United States, we have been sold a bill of goods. We have been misled to late treatment only. And look at the results. It's not parallel to what they're having in Taiwan. It's not what, you know, if you extrapolate the 25 million in Taiwan times 5 or 6, it would be the population of the United States. I don't think our numbers are looking like that. Look at Japan is 121 million. They're parallel to that. I'm talking about something that's a no-brainer. It's intuitive. It's a anti-inflammatory. It's safe. It's used on 2-pound premature babies in the ICU. It's used on the elderly, fragile in nursing homes, and everybody in between. It's safe. It's cheap. I'm saying $3 for a treatment. It's generic. Nobody's going to make any money off of this.
How long is the average treatment on the breathing treatment?
Let's talk about the experimental medicine. I think that's 5 or 6 days in the hospital, and you can't get it unless you're in the hospital, and you sign a waiver that you're willing to be a part of an experiment. And that's over $3,000, but the pharmaceutical company might be donating it, which means then they can write it off for taxes. A doctor pointed that out to me. And so let's just talk about, compare that to $200 for the or for the total amount. And being at home as opposed to being in the hospital, much less in the ICU, because if you're in the ICU, you might get intubated, which, by the way, there's been a concern about aerosolizing and spreading the virus in hospitals. That's one of their arguments against using the nebulizer in the hospital for this treatment of someone who's dying of COVID, by the way. But the research shows that they're looking the wrong direction, and they're not looking at the facts that are already in the literature. Research already shows the number one thing to aerosolize the virus, COVID or SARS or any virus, is intubating the patient, putting them on the ventilator. When you intubate the patient, that's the greatest risk, research shows, to the healthcare workers, doctors, nurses, lab techs, x-ray techs. It's the greatest risk to other patients in the hospital. The thing that aerosolizes the virus the most, the procedure that does that the most, is intubating the patient, which is where they put them in the hospital. But here's the good news. There's a hospital south of San Antonio that was full of COVID patients, and in 48 hours, without asking me, they saw that video on America Can We Talk, that's on YouTube, and they decided they did the research, and they decided, they had a meeting with the CEO and the doctors, all the staff got together, and they said, let's try this, it makes sense. And they emptied their ICU in 48 hours. None of the patients died, they all went home. And so and they sent me an email after the fact, and that's how I found out about it, is they reached out to me by email, and they said, prior to using your protocol, 50% of the people that ended up in their ICU with COVID eventually got intubated and transferred to San Antonio, a big hospital in San Antonio. And they said now that's not happening. And so now that community is employing early treatment. Wow, that's just an amazing new idea, apparently, to the World Health Organization, who, by the way, is listening to Communist China, who, by the way, the goodwill ambassador for the World Health Organization is the wife of the president of China. There's a whole lot of reasons why we're seeing what we're seeing for 7 months. I'd say they need to, our country needs to jump tracks, get off this losing train that's taking us through this path of destruction, a trail of tears, casualties everywhere, businesses, families, people are, what does the new normal look like? People dying alone at home, at the hospital, not allowed to have their loved ones around them when they die. A hospital here in Texas had a family drop their loved one off at the hospital and found out he was dead by watching it on the news. That's the new normal. Let's get back to reality, and let's do early treatment with a winning strategy, inhaled budesonide.
And that winning treatment, one more time, is?
Inhaled budesonide with a nebulizer, so you get more of the medicine down deep in the lungs. I use an antibiotic called clarithromycin when it's appropriate, because it protects from secondary bacterial pneumonia, because there's a risk of clotting total body that's increased with COVID. I have adults on aspirin, if they can tolerate it, if it's right for them, and zinc decreases virus multiplication, so that's my strategy.
Dr. Richard Bartlett, thank you, sir. We're going to take that quick break and go in